Hello, this is Lumen May with May's Message. I'm here today with Dr. Greer Hall of Community Health. Dr. Greer Hall and I have been doing these public service announcements for the last couple of weeks, just trying to educate the public on the dangers of this COVID 19. Welcome, Dr. Greer Hall.
Thank you so much, Commissioner May. Thank you for having me.
Well, thank you for being here. I know that we've leaned on you for the last couple of weeks, and we are certainly grateful.
Oh, you're so welcome. Anything I can do to help out, definitely.
Well, can you share some of the COVID 19 updates from your perspective?
Definitely. We are continuing to see an increased number of cases nationwide. We have over 870,000 cases of COVID 19 and over 50,000 deaths as of this morning nationwide. So, this respiratory virus is definitely continuing to take a toll on our country. The measures that have been taken thus far have, without a doubt, helped to decrease the number of cases, and also we want to flatten that curve that we hear referred to so many times. And so I can definitely tell you we're decreasing the numbers by doing these measures. And regardless of what happens over the next few weeks, as far as the country opening back up, it's going to be very imperative that we continue to take these measures if we want to make sure we continue to decrease our numbers. The COVID 19 virus is not going to just simply disappear when the country decides to open back up. And so it's imperative that we continue to do those things we've already discussed as far as social distancing and avoiding gatherings of more than 10 people, and making sure we're doing very good hand hygiene and wearing our face masks. So we have to continue these measures and not become complacent, even if the country opens back up these next few weeks.
Oh, thank you, Dr. Greer. How's the testing going in our area? I know we see a lot of national news, but how is it going here in Escambia County in Pensacola?
I think testing wise, we're doing very good. We have, as an organization, Community Health Northwest Florida, we have expanded our testing, and Sacred Heart as well. We've expanded testing to those with any symptoms whatsoever. So you do not necessarily have to have exposure or travel history to be tested. And anyone with symptoms who would like to get tested, they can get tested. And we are doing pretty good with our supplies here on a local level. Community Health Northwest Florida, in addition to what we've done with Brownsville and over in Cantonment, we have also expanded our testing to those who are maybe not able to get to those facilities and locations. And we have now expanded to walk-up testing at some of our areas here in town. Just this past Wednesday, we were in Addis Court providing services for over 255 residents. Today, we are over at Morris Court, Sanchez Court, providing services. So we're trying to make sure we get out to those communities who may not be able to get to Brownsville or Sacred or to Cantonment sites, so we can test those residents as well. So we're doing a great job. And next week, we're looking forward to doing more testing in Pensacola Village, as well as in Santa Rosa. So we are going to be expanding what we're doing, Oakwood Terrace. So all of this information will be posted. So these residents in these locations can hopefully find out more information about where we're going to be. But we're going to be expanding our testings and our abilities right now. I think we're doing really, really good. And we're hoping to identify those who are asymptomatic, because we know there's a lot of asymptomatic transmission going around. So if you feel like you have it, or if you were exposed, or if you have travel, or if you have symptoms, we want to make sure we are supplying those resources for our community. And I think we're doing pretty good so far.
Yeah, I can concur. And I tell you, when we first reached out to Community Health, to you and Sandra Smile and Sandra Donaldson, we were probably one of the first places that went into the pockets of poverty and set up at Brownsville. And we learned and we realized that there are other barriers, and we moved forward, as you said, to doing over 250 people in Addis Court. And today into Morris Court, and we're moving throughout the community. So I want to
Right.
thank you. And it's just a great partnership between, my office and your office, Community Health, Escambia County, and for us to be able to take resources to the people. And I often say
Yes.
that we have to be able to break down any barrier that would prohibit someone from being tested. And we're breaking down barriers to make sure everyone can be tested. And the great thing about it, if you have insurance, obviously you bring that card, but it's free of charge
Mhm.
because community health and safety is our number one priority.
Exactly. Definitely. We want to provide those services. And as long as we can, we will continue to do that. So get tested.
Well, you're doing well. Listen, I only have one more question. I know your time's valuable and you're
Mhm.
taking care of our most precious asset, our children. And I know that the health department is working with some long-term facilities such as nursing homes. We've seen uprise in the number of cases and positives that we found in our nursing homes and senior
Mhm.
nursing. Do you have any information on that or any insight? Because I know
Yeah,
can't go see their grandparents, so they're worried right now.
right, right. And the Department of Health has teamed up with some local hospitals to provide testing for the residents and the staff at our local assisted living facilities and at our nursing homes here. And this is a very, very vulnerable population that is at highest risk for complications and death of COVID-19. So it's very important for us as a community. And I'm so, so happy that we've taken this measure because we want to prevent these deaths in this population of patients. So we have seen that this is taking place. We're identifying those residents who have COVID-19 and hopefully preventing the spread of the disease and preventing deaths in those in assisted living facilities. And this is something I believe is taking place at least as far as Florida is concerned, but nationwide, I think this is something that's being done to prevent the deaths in this population.
Yeah, and you talked about it earlier as we look for the peak and the plateau and how we level out. Exactly where are we? Are we out the woods? Are we at the edge of the woods or the middle of the woods? Where are we in terms of this virus, Dr. Greerhall?
I would like to hope we're at the plateau and we're heading out of the woods, but it's really going to depend on what happens when the country opens back up and if we continue to take those measures we've already discussed and whether we see a resurgence or not, because that is something as healthcare providers we are very concerned that we may see a resurgence of this virus if we don't take those measures seriously. Because as we gather, we could definitely see an increased number of cases so it's really hard to say. We would like to think based on the numbers and the data that's been shown over the last week, and we're seeing decreased number of cases. However, we are still seeing new cases that are rising. So it really depends on what happens when the country opens back up. If there will be a resurgence this summer, I pray there is not a resurgence. But we have to keep in mind, this is a new virus. We don't know a lot about it. We would like to think, by summertime we'll be in a better place, but it really depends on the community taking it seriously and continuing to do whatever possible to decrease the spread of COVID-19.
Well, Dr. Greenhall, a lot of people are talking about the resurgence and when the flu season comes back. I mean, how cautious do we need to be as we go out of the summer months into the fall months?
Very cautious. Very, very cautious. It's very important, especially because there are so many similar symptoms you can see between flu and COVID with fever and body aches and just fatigue and malaise. You can see the exact same symptoms with both illnesses. And so it's going to be very, very important for those who can get a flu shot to get a flu shot. If you can get a flu shot, we encourage you to get your flu shot when it's time for that to come around in the fall. But the diseases are very similar. So it's going to be important for us to keep that in mind. Is it the flu? Is it COVID? Hopefully, if you get a flu shot, it won't be the flu, but it could definitely be COVID-19. And we don't know if this is going to be a seasonal illness or if this is just a one-time thing, but we have some suspicions that this could be seasonal. So we may see a resurgence of this and we may see it come along again in the fall with the flu. So we have to just keep that in mind. There's a lot of unknowns.
A lot of unknowns, absolutely. And so we say to those who are listening, those who follow us, be prayerful, be mindful, be smart, be aware. Be aware that this virus is a killer and it adversely affects those who have pre-existing conditions. We know that it's been a lot of people that have got the virus that were asymptomatic that have passed it on to others. And so we just want everybody to be aware and be concerned. So thank you, Dr. Greer, for Dr. Greer Hall. I mean, we go back a long way. So I remember Michelle Greer. And, yeah, but I love the respect of the title. And thank you for your work and the work you do at Florida State, the work that you do in pediatrics. I mean, there are very few children who've come along that have not had their hands touched by Dr. Greer Hall. And we appreciate it. We appreciate your leadership. Is there a closing word that you would leave with our citizens?
I just want to encourage everyone to continue to stay home, stay safe, and stay well. Take care of yourselves. Take care of your other pre-existing conditions, your blood pressure, your cholesterol, your obesity. Continue to take care of yourselves because we want to make sure, especially those with those pre-existing conditions that are at highest risk, just take care of those other conditions so that hopefully will decrease your risk of COVID-19. So stay well.
Yeah. Well, I hope y'all listening to Dr. Greer Hall. No one is immune. I mean, we're all susceptible to this virus. So please stay home, stay in. As we say, get your social distance, but really get your physical distance. Socially, you can do what Dr. Greer Hall and I are doing. We're on opposite sides of town. I'm in the heart of Brownville. She's at her office off of Airport. But we're communicating, we're getting information out, and we're able to do it virtually. And so we encourage people to do that. You can communicate with your mom, your dad, your aunt, your uncles, your friends by using all the technology. There's so much, there's so much technology that has surfaced since this virus. So I think there are going to be some positives that we all will get when this is all over. So Dr. Greer, thank you for joining May's Message as always. We appreciate your service to this community.
Thank you so much.
God bless each of you. Have a good day. This is Commissioner Luman May, and thank you for joining May's Message.